So having used the Lumenis 100-watt laser for more than 1,000 HoLEP cases now, I thought that it was the perfect tool for the job. But I was very pleasantly surprised by the Pulse 120. It offers a far superior HoLEP procedure, and I'm really excited by that. The VersaCut Plus morcellator was much faster than the current version. The morcellation rates halved, and the handpiece was much more ergonomic. It's much lighter and it's much easier to use. I found with increasing HoLEP experience that I became much faster at the enucleation procedure. However, the downside with the 100-watt machine was that often I had to slow down to go back to get hemostasis. With this new Pulse 120, I found that no matter how fast I went with the enucleation, I never had to go back and get hemostasis. It was extremely hemostatic. So the bleeding control was much, much better, and it allowed me to operate much more quickly. One of the issues I had with the 100-watt machine was that the faster I went, the more difficult the vision became, often due to bleeding. But with this new Pulse 120 machine, I found that no matter how fast I went with it, the hemostasis was excellent, the view was very good, and I didn't have to slow down at all. Another advantage of the Pulse 120 was a much wider range of settings that are available compared to the 100-watt Lumenis laser. And the beauty of this was that there are settings that are better for hemostasis and some settings that are better for incision of the prostate itself. So during one procedure, I was able to quite easily change the settings to give me the perfect tool. My experience with the P120 was that it significantly decreased the operating time. It wasn't just the laser phase that was much shorter. In fact, that was halved, but also the morcellator worked much more quickly. So overall, there were significant improvements in efficiency with the HoLEP procedure. And I think that it's not just improvements in the efficiency of the procedure that these new pieces of kit will allow, but also I think it will allow people to learn the procedure much more easily. I found it much easier to stay in the surgical plane with the P120 than the 100-watt laser, and the morcellator, being more ergonomic, is easier and I think safer to use for beginners. One of the excellent consequences of using the Pulse 120 was that the patients were able to go home the same day with extremely clear urine. As I've already mentioned, the hemostasis is far better with the Pulse 120 than it is with the 100-watt laser, and this I'm sure will allow us to perform far more day surgery HoLEP procedures. The unrivaled commitment of Lumenis to the training and support of clinicians wanting to learn and introduce endoscopic enucleation for BPH is evident by two recent innovations. The first is the very first realistic prostate model that can be used for simulation, which has made a massive improvement in terms of us being able to teach people safely how to do the procedure. And the second innovation is the formation recently of the Holmium Academy. And the Holmium Academy is organizing courses in HoLEP training throughout the world, and there are more than 30 courses on offer this year alone.